This is James, and he has volunteered to be my patient today. We're going to do the abdominal segment for assessment 5.1. We are going to observe the skin of his abdomen, and notice that there is a consistent pattern. The color is pink. There's no venous patterns, lesions. There's no scarring, but there are several areas of striae noted. It is round or protuberant. He does have an increased BMI, which makes it a little bit harder to locate structures and percuss areas. The umbilicus is centered, and its mid-abdomen is round. It is inverted. I'm going to look for symmetry. I'm going to stand behind the patient over his head, and I'm going to make sure that there's no distension areas or any type of bulges, and I do not necessarily see anything obvious. No, there's no abdominal hernias or abnormalities. I'm going to have you take a deep breath and you're going to put your hand down. Deep breath, and you got to raise your head up. No, yeah, there you go. And you can tell that there's no abnormalities of his abdomen. Let's see. Next thing we're going to do is we're going to auscultate, and we're going to listen to all 4 quads of the abdomen. I'm probably going to have to help me. Move the camera here. And we are going to auscultate all 4 areas of the abdomen. I'm also going to listen for vascular sounds over the liver, and over the spleen, and also over the aorta, and over the renal arteries, iliac arteries, and the femoral arteries, which is not really able to get to, but over the femoral artery area. There's no presence of negative for a bruise. Next, we're going to percuss over the abdomen, and we're going to check for activity. Should be over airfield, over the organs, the stomach, intestines. Activity may be louder in patients such as James with slow motility because of all the gas accumulation. He does have some irritable bowel syndrome, and he does have a current abdominal infection as far as colitis at this present time. So you have to pull the camera for me though. Okay. So I'm going to percuss up over the abdomen. And also you'll hear a dullness over solid organs, the liver, or over a full bladder, or a mass, which he doesn't have any masses today. Next, we're going to do the liver span. We're going to start percussion on the right mid-clavicular line over a tympanic area, and then we're going to percuss up until, it's hard to until the dullness changes, and then we're going to actually mark the spot, which I did that prior to recording. And mark this as the liver's lower border, just below the costal margin. And then we're going to percuss lower border. And then we're going to percuss from the lungs resonant sound down the mid-glottal line until the sound changes to dullness. And we're going to mark that at the liver's upper border, and that's usually between the 5th to 7th intercostal spaces. And we're going to measure this distance, and the normal liver span is usually between 6 to 12 centimeters. We are also going to hold that up a little this way. Yeah. There you go. Percuss over the left anterior rib cage in the left epigastric region. Oh, sorry. You gotta hold your breath. Press over the left lower anterior rib cage, the left epigastric region, over the spleen, while the patient takes a deep breath, and then the gastric air bubble, the tympani should have a lower pitch than the breathe out than the intestinal tympani. Okay, breathe out. Okay. All right, and then with light palpation, which his belly's kind of tender right now, his abdomen's tender since he does have some colitis. He does have just a slight distension on his upper epigastric area. He's a little bit upturned and tender, whereas colitis, and he also has some diabetic gastroparesis going on right now. Let's see, light palpation all over the quads. Just not depressing more than 1 centimeter, and then we're going to do moderate palpation, a little bit deeper, and then deeper palpation. And there's no masses, tenderness over the cecum or the aortic or the xiphoid process area. We're going to palpate around the abdominal, around the umbilical ring of the abdomen. And there's no presence of hernia. It is round, regular, and free of bulges or masses. And then I'm actually going to do the hook method to palpate the liver. I'm going to paste on the costal border and hook my fingers up underneath costal margin. Take a deep breath, hold it, and look for the liver's edge. And it's not decisively felt underneath my fingers due to his distension, but I can feel some of the liver's border. Spleen palpation, let's see. I'm going to take my hand and press against the costrovertebral angle and place fingertips just below the costrovertebral, the costal margin. Take a deep breath and hold it. And with inspiration, press my fingertips toward the spleen. The spleen should not be palpable, and it is not. Let's see, kidney. And with the kidney, I'm going to place hand under the flank, under his flank. And then over the right costal. Don't hold your breath. Relax. The costal margin. Now take a deep breath. And at the height of the inspiration, and push both hands together and try to capture the kidney. And exhale. And hold. And then you release slowly and wait for the kidney to slide between your fingers. But this is not as practical with the protruding abdomen. It's not as likely to be felt. Definitely not less likely to be felt on the left than it is on the right. But however, a normal kidney should be smooth. It should be firm. It should be non-tender. And then for aortic palpation, I'm going to time on this one. To press my thumb and forefinger in a cup shape along the aorta, and palpate. It should pulsate in an anterior direction. I'm not able to palpate his aorta. The abdominal reflex testing. Let's see. It says use the handle of a hammer, and then reflex hammer, and then stroke. I don't have that, but I'm going to improvise. I'm going to take my marker here and I'm going to stroke. Yes. And you can see his abdomen move with the reflex. Up and away toward the upper quadrants, and then down and away with the lower quadrants. And you can see with each stroke that it causes the abdominal muscles to move or contract, and the umbilicus did pull up to one side. That concludes this segment. Let's see. Can I get that in? Let's see if I can get it in. Percussion of the kidney. I'm going to put the palm over the costovertebral angle, and let's see, you'll have to turn on your side. Yeah, turn all the way aside. I'm going to take my palm along the angle of the costovertebral angle, and then I'm going to take the ulnar surface, and then I would tap against my hand. In an ideal situation, if I had somebody holding the camera for it, it'd be easier to see, but you take my hand, and then I would take, with my hand covering the costovertebral angle, then I would take my fist and pound against my hand. And there should be on either side, should not be any tenderness. And let's see. I think that concludes the segment. Thank you.